Hello friends, as you all are aware, we have started new sections on our YouTube channel and one of them is clinical case-based discussion. It will be useful for a PG entrance preparation as well as for first prof exams. So one such MCQ we are discussing in this video. Let's see what the question is and what you should write if it's a first prof exam question, and let's see the MCQ answer as well. A patient with complaints of breathlessness. I hope the first year students are aware this is complaints of breathlessness, giddiness and syncope. So it could be possibly a CVS related ailment or it could be respiratory system. We are not sure right now. Blood pressure 160 by 6 mm of Hg. So that gives some confirmation that this is CVS related ailment. His left ventricular pressure volume loop is shown below. And then the question is, what is the probable diagnosis? That's the MCQ. This is the loop shown here. And as you can see, the normal loop and the deviation from the normal has been shown here. The options are pericardial effusion or aortic regurgitation or mitral regurgitation or left-sided heart failure. So these were the options given. You want to answer that? Okay, the answer is aortic regurgitation. Now let's find out why the answer is aortic regurgitation, and also let's see what question can be asked from such a case. Prof level question can be, what is the probable diagnosis? Normal PV changes, write down about the normal pressure volume changes and add a note on valvular heart disease as the applied aspect. Now I know that diagnosing the condition is not generally taught at the first prof level, but then if you see the second question and third question, which is normally the case, that they are sequential, consequential, they are related to the first question and they give hint. In this case, normal pressure volume changes are to be described. It should immediately strike to you that the case is related to the CVS and pressure volume changes are being asked. Where do you read pressure volume changes? Of course, it is cardiac cycle, pressure volume changes during the cardiac cycle. So then you got to write just the theory part and atrial pressure changes and left ventricular pressure volume changes, and then add a note on valvular heart disease. That will be a quick note at the end. So this is how you can attempt the question if it's a first prof level question. We will discuss the answer also, but right now let's start with the MCQ. The answer is, for the MCQ, the answer is aortic regurgitation. Why? Let's find out. The blood pressure given is 160 by 6 mm of Hg. Diastolic blood pressure is so low. Now that is giving a big hint that it could be aortic regurgitation. Why is that? Let's see. For the first prof level, what are the valvular heart diseases? Let's discuss that first quickly. There are two types of valvular heart diseases if the question is asked like this: stenosis and regurgitation. In stenosis, the valve orifice is narrowed and therefore not enough amount of blood can go through that valve into the next chamber. So if we are talking about mitral stenosis, then enough blood will not go from left atrium to left ventricle because of the steno. Valve orifice is narrowed and the valve leaflets adhere to each other. That's the abnormality in stenosis. The other type of valvular heart disease is regurgitation. Regurgitant valves. It means valve is dysfunctional and it is unable to perform its function of preventing the backflow of blood. That's regurgitation or regurgitant valves, previously called as incompetent valves. So let's see here why this could be aortic regurgitation. You can see here that during systole, the blood is ejected out of the left ventricle and it fills the aorta and arterial system, and that creates the systolic blood pressure. Now in this patient, systolic BP is fairly in the range 160, fine. But during diastole, what normally happens is at the start of ventricular diastole, the aortic valve closes normally, and therefore the blood that was ejected into the arterial system, it stays there and it creates the diastolic blood pressure. So it could from 120, 130, it could drop to, let's say, 70 or 80 mm of Hg. That's the diastolic blood pressure. In the condition of aortic regurgitation, what happens is left ventricle ejects the blood during systole, that's fine. But as the diastole starts, left ventricular pressure falls and the blood that has gone ahead now starts coming back towards the left ventricle. And since aortic valve is incompetent, dysfunctional, the blood goes all the way back into the left ventricle, which means what? There is hardly any blood left or less amount of blood left in the aorta and arterial system. Much of the blood has regurgitated back into the left ventricle. Since there is less amount of blood, less volume of blood in the aorta and arterial system during diastole, the diastolic BP will be low. It can be as low as even 6 mm of Hg as in this case. So therefore that was a big hint that it could be aortic regurgitation. Now let's go further and see the LVPV loop, left ventricular pressure volume loop. I'm sure you must have studied the normal LVPV loops. Let's quickly revise it. There are 4 phases in the LVPV loop. Phase 1 is the phase of filling because the blood goes from 50 to 130 ml in the left ventricle. Then phase 2 is isovolumic contraction. Phase 3 is the phase of ejection, and phase 4 is isovolumic relaxation. You can see here once again, phase of filling, then isovolumic contraction, then ejection, then isovolumic relaxation. Now, look at the deviation. The first thing that strikes us is that isovolumic contraction and isovolumic relaxation, these 2 phases are abnormal in this patient. And that is another hint. So please remember this forever now from this point, that in the conditions of regurgitation, there is no true isovolumic contraction, there is no true isovolumic relaxation. I repeat once again, if there is regurgitant valve, then there cannot be isovolumic contraction, there cannot be isovolumic relaxation. You can see here that the lines are straight, means volume remains the same during this phase, isovolumic contraction, and then again straight line coming down, pressure is falling, but the volume same. That's the isovolumic contraction and relaxation normally. But now in this case, what is happening? During the isovolumic contraction phase, the arrow is going like this. So first things first, what does it mean? It means the volume, which should have remained constant like this, 130 ml, 130 ml volume, only the pressure is rising. Volume is increasing. So please remember, if you are going to that side, there is increased volume. If it comes to this side, it is decreased volume. So in this case, volume is increasing during isovolumic contraction. Isovolumic contraction, so called. But volume is not remaining the same. It's increasing. This typically happens in aortic regurgitation. Let's quickly see why it happens like that. Isovolumic contraction. Remember the isovolumic contraction phase? Ventricles begin to contract and AV valves are closed, but semilunar valves are yet to open, right? So both all four valves are closed and ventricles are contracting like a closed chamber. That's isovolumic contraction, right? Talking about the left ventricle, what will be the isovolumic contraction? Normally, the mitral valve closes. You can see here, mitral valve closes, but aortic valve is yet to open. So aortic valve also closed, mitral valve also closed, and left ventricle is contracting. That is isovolumic contraction, right? Aortic valve is yet to open. Why? Because left ventricular pressure, which is rising, but it has not become greater than the aorta pressure. Only then the aortic valve will open, isn't it? I'm talking about the normal condition. So left ventricular pressure has not increased and become more than the aorta pressure. So aortic valve has not yet opened and AV valve has got closed. That is isovolumic contraction, right? Left ventricular pressure has not become greater than the aorta pressure means what? Means aorta pressure is greater than the left ventricular pressure. So imagine in the isovolumic contraction, aorta pressure is still greater than the left ventricular pressure and the aortic valve is regurgitant. It means what? It means the blood will simply regurgitate from aorta back into the left ventricle during isovolumic contraction. Have you understood this part? I hope you've understood. Both these valves are closed. That is the isovolumic contraction. I am only talking about the left ventricle. The mitral valve has got closed and aortic valve is yet to open. So that means both valves are closed and left ventricle is contracting. That is isovolumic contraction. Blood cannot go anywhere. That is the normal situation. And why the aortic valve has not yet opened? Because left ventricular pressure has not become more than the aorta pressure so far during isovolumic contraction. Which means what? Which means aorta pressure is still greater than the left ventricular pressure. So imagine aorta pressure more than the left ventricular pressure and aortic valve regurgitant. What will happen? Blood knows only one thing, to go from high to low pressure. So it will regurgitate back into the left ventricle during isovolumic contraction. So I'm calling it so-called isovolumic contraction in this case. Blood is regurgitating back into the left ventricle during isovolumic contraction. That means left ventricular volume is increasing, and that is what is shown in this line. Straight line means isovolumic. Line going there is volume is increasing, right? Volume on the horizontal axis, straight line versus the line going there, volume is increasing. All right, that was isovolumic contraction. Now then, what happens during isovolumic relaxation? Just revise isovolumic relaxation in your mind. During isovolumic relaxation, aortic valve closes but mitral valve is yet to open for left ventricle. Aortic valve closes but mitral valve is yet to open, and the ventricle is relaxing like a closed chamber. That is isovolumic relaxation. And finally the mitral valve will open and filling will start, but we are not interested in that. Aortic valve closes at the start of ventricular diastole. Aortic valve closes. Why? Because left ventricle begins to relax and its pressure goes below the aorta pressure. Its pressure, left ventricular pressure, becomes less than the aorta pressure. So aortic valve closes. That is what happens normally during isovolumic relaxation. Now in this case, left ventricular pressure is falling. Now I'm talking about aortic regurgitation. What happens is left ventricle begins to relax. It is isovolumic relaxation. That means left ventricular pressure has gone below the aorta pressure. Which means what? Which means aorta pressure is greater than the left ventricular pressure in the isovolumic relaxation. So aorta pressure greater than the left ventricular pressure and aortic valve regurgitant. What will happen? again the blood will flow back from aorta back into the left ventricle. Regurgitation of blood will happen again in the isovolumic relaxation, which means the ventricle will not remain isovolumic, isn't it? These two valves should be closed and ventricle is relaxing. That is isovolumic relaxation. It cannot receive blood from anywhere. That is normally. In this case, during isovolumic relaxation, blood regurgitates back from aorta back into the left ventricle because aortic valve is regurgitant. And therefore, you can see here in the loop, this is the isovolumic relaxation. Straight line, volume same, not changing. That was for normal. And this is the deviation. You can see here, the pressure is falling. On the vertical axis, there is pressure. Pressure is falling, but volume, which should have remained the same, that's shown by the straight line, volume is increasing again during isovolumic relaxation. Ventricle is not remaining isovolumic. Volume in the ventricle is increasing. How can you say that? Because see, this is the starting point of the phase. Volume was 50 ml. And this is where it has ended. The phase has ended in the patient. That means, let's say 70-80 ml. That means during this phase, blood was filled in the left ventricle during isovolumic relaxation. Ventricle is not isovolumic. Blood is coming into the left ventricle from the aorta and its volume is increasing even as the pressure falls. Downward arrow means pressure is falling, but then volume should have remained the same. It's not remaining the same. It's increasing. So therefore, that was the case of aortic regurgitation. And we saw, just remember and repeat once again, in the regurgitant valve conditions, there is no true isovolumic contraction. There is no true isovolumic relaxation. If you see the changes in these, then it is certainly regurgitant valve condition. So that was the diagnosis and that was the answer. The other conditions we can discuss in some other graphs or some other case. For example, pericardial effusion. Then there will be problem with the expansion of the left ventricle or ventricles. And because of that problem, phase of filling will greatly affected. So if you see this line, which is the phase of filling, if it is going up or deviated, then you can say it's pericardial effusion. Anyways, that we'll discuss in some other case. But that was the MCQ with its answer and explanation. So if you are a first prof student, just again, what is the probable diagnosis? It was aortic regurgitation, normal pressure volume changes. You can write cardiac cycle, left ventricular pressure volume changes, and even atrial pressure changes. And add a note on valvular heart disease, stenosis, regurgitation in quick 3-4 lines. And that will be good enough or even more than enough for your first prof exam. Many more such MCQs will come up for discussion. So it will be a good idea to subscribe to the channel and hit the bell icon.